So my name is Mark. I'm a GP in Dublin, and I am very grateful for the invitation to speak here. I think Atheist Ireland have been fantastic advocates for an evidence-based and human rights-based approach to managing what are very complex issues, crisis pregnancy. And Ashling, in particular, you were really fantastic in the Citizens' Assembly. So well done to you. I'm really looking forward to hearing Bernadette, who I haven't heard speak before, but I'm really looking forward to hearing you. And I think we're really lucky to hear Cliona and Krysia. And I have to say, I've learned so much. When you hear the story from the 19th century up to today, through repeated self-harms of these referenda, I think it's so damaging to our society. And I just think the way you articulated our history, it really paints a very stark picture of why we're here and the real impetus of why we need to change things. So I'm conscious I'm the only male speaker here. So I'm here because I'm a doctor, and I'm here really to advocate for women so they can have access to evidence-based management of crisis pregnancy. And as a doctor, we have to put evidence-based principles to the forefront. That's a fundamental, foundational principle in medicine. And there's also that lens of providing what is compassionate and patient-centered care. And there are a variety of other ethical and moral principles too. But I think I will outline some of those evidence-based, compassionate reasons why I'm active in this area. The first is what transcends the hierarchy of evidence in medicine. It's a self-evident fact, so it's a truth that the 8th Amendment was designed to prevent abortion. And as was very eloquently outlined, the 8th Amendment has failed spectacularly to do that. Not only has it failed to prevent abortion, it's actually caused unsafe abortion in Ireland, and it's forced 170,000 women, roughly, probably more, to travel abroad. And it's been uniquely harming and damaging to those women. And when you stand back, that self-evident truth is a real shame on our Irish psyche and society, and something we really need to right. The advent of the abortion pill has changed that landscape, and it has provided women who do not have the financial means or the physical means due to disability or the legal means if they're an asylum seeker. It's provided them with a chance to have access to an abortion when they choose, but it's in far from ideal circumstances. And women, at least three to five women a day, take an abortion pill. So today, 3 women at least took a pill. And they did that unsupervised, without any medical supervision from someone like Krysia or myself. No one there to discuss this with them, to share that experience, to make it safe. We don't know where the pill came from, typically, and many other providers are unregulated. And I think that is a real tragedy, that we force those women into that situation of significant clinical risk. Last month, a woman took the wrong dose at the wrong time, and she had a uterine rupture. And she presented to a Dublin hospital. This is what we're standing over at the moment. It's really barbaric, and I think we have to realise that the threat of criminalisation hangs over these women as well. So, can a woman come to me if she's having a minor side effect or complication? Well, she might not, because she's worried about that 14-year jail sentence is in the back of their minds. What would the doctor say? And I think that's a real chilling factor over the woman, and obviously there's a chilling factor over the doctor. I think the other fact and evidence that is very clear is the litany of harms that the 8th Amendment has caused. The Institute of Obstetricians and Gynecologists, in my opinion, have been fantastic advocates in the past 2 months about the harms caused. And Peter Boylan has spoken of at least 4 women who have lost their life due to the 8th Amendment. And we know that Savita Halappanavar died, and one of the main contributory factors was the fact that there was no real and substantial risk to her life when she presented on Sunday or on Monday or on Tuesday. And on Tuesday she asked for a termination of pregnancy. She was bleeding and in pain, and the fetal heart was present, and the obstetrician felt she could not act. Professor Amar Cullerman was very clear. Dr. Peter Boylan has been very clear. She would be alive if she presented in another country. But the list of harms are far broader than those deaths, and obviously it is very convenient to say that Ireland is one of the safest countries in the world to have a baby, and I think our maternal mortality is probably average. But you have to consider all the crisis pregnancies that have been systematically mismanaged in Ireland and managed abroad, and we have caused huge harm. You look at Miss Y, who was a pregnant, unfortunately as a result of sexual assault, sought an abortion abroad, and she was prevented from accessing an abortion abroad. She became suicidal, she was involuntarily admitted, and she was forced to undergo a caesarean section at 25 weeks. The case of Miss PP, who was on life support. She was effectively brain dead, and the doctors didn't think they could turn off the life machine because of the 8th Amendment. And you have an whole alphabet of harm. You have the real heroes are those women who are actually telling their stories, and they're so brave, and they shouldn't have to do that, and terminations for medical reasons. They have been uniquely harmed, distressed and damaged, those couples, because of the 8th Amendment. That's a real harm. Last year there was a 12-year-old who was forced to travel abroad, who was a victim of rape and was forced to travel abroad to access compassionate evidence-based healthcare. That's a harm. And really every woman who has been forced to travel with that shroud of stigma and shame has been harmed. The difficulty of obtaining childcare, of doing something secret. And I think we know that abortion is very safe. We know that the World Health Organization recommend access to the abortion pill up to 12 weeks. But in Ireland we don't have that, and that is very damaging. On the 12-week issue, as was outlined, the general scheme which will come in if a yes vote happens on the 25th of May is really the most workable and reasonable legislation that could possibly follow if you remove a constitutional prohibition. It will reduce the number of terminations of pregnancy with a suite of sexual health recommendations, crisis pregnancy prevention recommendations that allow for terminations in the case of fatal fetal abnormalities. And it will provide for abortion up to 12 weeks. But I want to be very clear about that. That's what the World Health Organization recommends as a minimum threshold. It's a very tight timeline with a 3-day wait period, with protocols very regulated. And I would be a provider. I'll prescribe a pill and make that abortion safe. And we know that women are already taking the abortion pill up to 12 weeks. We know that it's the only way that we can provide women, particularly as a result of sexual assault, who do become pregnant, a ground to access abortion care. So I think that the legislation is evidence-based, responsible, and I certainly, and I know many doctors in every county of this country who are committed to providing that care, and I will be one of those providers. I think Ireland has changed a lot since really an Orthodox Catholic amendment was inserted into the Constitution in 1983 that governed women's lives in healthcare. And that was democratically inserted in the Constitution. And that was a symbol of our culture and time back then, 35 years ago. And that was the democratic right of the people then. But I think we do need to trust politicians. Our country has moved on, and our cultures and values. We treat crisis pregnancy differently now. We don't lock women up in a laundry and force them to give birth. And our cultures and values have changed. And our constitution is not the place to fix ourselves into the past, and it's been uniquely harming. And I think our values have changed, and we are more secular. And I think removing the 8th Amendment will really allow us not, at the moment, Westminster is where we have legislation to govern our crisis pregnancy management. And I think as we're approaching the 100-year anniversary of the start of our state and declaring our independence, it's kind of a strange irony that we allow Westminster care and develop the laws and care for women. And I think we need to control that in whatever way it is. And maybe our constitution, or maybe our legislature might become more conservative in the future, who knows? But that needs to be dynamic, and that is the heart of democracy. So I think there are a variety of other reasons and uncertainties in the future about the provision of care, and I'd be happy to answer that later if needs be. But I'm here to say that while some doctors may conscientiously object, a few, and I would support their right, those few doctors, most doctors are committed to providing care, and they need to be supported. And whilst a few structures and processes and protocols need to be agreed, like any other healthcare service, the medical profession and the wider healthcare community are very, very committed to providing that care. So thank you very much for asking me to come here, and I'm very confident that a yes vote can happen, but I really hope that we do need to promote conversations, the evidence, the discussion, and I think we can turn our backs, as you said, to that dilemma of what a no will mean, that repeated harm to our country, and what a yes means: more compassion, more evidence-based healthcare. Right. Thanks very much.